gentlemen, let's begin our first keynote session. Dr. KVNN Santosh Murthy, founder and podiatric and burn surgeon, Advanced Wound Healing Clinics, a renowned specialist in advanced wound care, podiatry and burn surgery. Dr. KVNN Santosh Murthy is dedicated to delivering innovative treatments and improve healing outcomes and enhance patients' quality of life.
So good afternoon everyone. I'm Dr. KVNN Santosh Murthy. I'm a podiatric surgeon and burn surgeon. So thanks to Insight Success, last time they invited me to Dubai and today in my hometown Hyderabad, so I'm really happy to be part of this. Since we all know that podiatry is something very new, I don't know how many of you know about podiatry here. Yeah, okay. See, out of 100, only one person is lifting the hand. So podia means basically foot. So what is the importance of foot? We all came all the way walking because we have healthy feet. So feet is so important. You have a good heart, fine, but you don't have legs to walk. So in our life journey, from birth till our death, the one which is carrying us all the way is our feet. And we neglect our feet the most. రోజు పొద్దున లేచి అద్దంలో మొహం చూసుకుంటాం, కానీ కాళ్ళు చూసుకోం. We came all the way, we are walking, we have so much of pain in our legs, especially ladies. They have how much of pain in the legs, still they'll continue doing all the household activities. They'll be struggling, they'll have all the pains at night, without cramps, they are unable to sleep also. I think most of the ladies here can relate themselves. But is podiatry only pain? It is preventing amputations. That is the main goal. So feet are so important, but how many people are actually having healthy feet? If you go across the world right now, the situation is every second there is a birth and every 2 seconds there is a death. But every 30 seconds a person is losing a limb. So amputation is happening for every 30 seconds across the world. Almost, if you say 40% of the world, say 1,000 crores of population, 40% are already diabetic and pre-diabetic area. And out of this 40%, 10% have already lost their limbs or at the verge of losing their limbs. It means if you count around, almost 100 crores of population are ready to lose their legs. Is it a joke? What about 100 crores families? How much are they struggling? One earning person of the family has lost their toe and he is not earning, sitting in the family and becoming a burden to his family. What will be the psychological thing going around? How many of our fathers, grandfathers are really struggling, and how do they feel inside that I have to depend on my people? So, saving legs. How many people are actually working on saving legs? You have a wound, they do the dressing, and then it's not healing, go for amputation. It is so simple to offer people amputation, but if the same thing happens to you or your family members, do you want amputation or you want to heal it? So time and patience is healing. Can I have my presentation please? Yeah. So saving legs is all about regeneration. So at Advanced Wound Healing Clinics, which have started in Musarambag Metro Station, we work on 3 aspects: RRR. Restoration, rejuvenation and regeneration. Regeneration is the key, not putting a blade and cutting off. Me being a general surgeon, endoscopic and laparoscopic surgeon, I have completely shifted my thought process, completely shifted my practice into wound healing. Because my professors used to tell me that a good surgeon is the one who knows how to use a blade. And the best surgeon is the one who knows when not to put a blade. So, just imagine, like there are so many ladies here, you can relate with this. You have hysterectomies, you have you have deliveries to go through, you lose around like a half liter to 1 liter of blood, and so much of blood loss is there. Still, when the surgeon puts sutures, 7 days the wound is healing, 9th day you're removing the sutures, everything is fine. But in your feet, where there is no blood supply at all, you still want to put a blade and cut it off. Is it going to heal? That's the reason diabetic foot patients end up into amputations. Those are the areas where there is no blood supply. So what you have to do? Improve the vascularity, then you can do something. The problem is internally, we are trying to heal externally. That's the reason we lose limbs. So that's why this particular department I have named it as the missing department of modern medical system. So what is this missing department? Who owns the wounded patients? Who owns them? Suppose any of our relative or anybody is having a wound. He is diabetic. He'll go to a physician. He'll go to a diabetologist. From there he'll be sent to a physiotherapist. From there he'll be sent to a nursing care. Or sometimes if there is a bone infection, he'll be sent to orthopedician. So they are doing their particular thing. If because of the patient is bedridden, he develops a cardiac issue also, he'll go to a cardiologist. But who is actually treating him? Who is taking care? Who is the owner of this? Who is responsible for that patient? No one. Nobody is taking responsibility. That's why you're going for amputation at the end. So you have department of cardiology, neurology, nephrology, radiology, you have got dermatology, everything. There is no departments of wounds. Every department has a wound. And nobody takes care of that particular wound. They'll say, offer to a sister or nurse, ask them to do a dressing and leave it. Heals, नहीं हुआ, हमने तो सर्जरी कर दिया, आपकी बॉडी में स्ट्रेंथ नहीं था, हील नहीं हो रहा. Finally end up into an orthopedician or a plastic surgeon or a vascular surgeon who will do an amputation first and then try to close the wound. Is this in 2026 the medical system which has grown such a humongously, still we have to depend on amputations? Is it right? Do you want our family or anybody of us to have an amputation? Never. So the forgotten patient, that's what. Once the problem is solved, the patient with a wound is forgotten. He's left. Nothing is being done to him. He has to go to all the departments asking one or the other person. He has to go to the nutritionist. He has to go to nursing care. He has to go to orthopedician, everywhere. But nobody is owning the wound. They will do the particular thing and leave it. So if wound is a banyan tree, okay, this is department of wounds. If wound is a banyan tree, podiatric wounds and burns wounds are the two major branches. And under this, you will have diabetic foots, neuropathic ulcers, ischemic, osteomyelitis, amputation prevention. You have got non-healing wounds, traumatic wounds, post-operative wounds, pressure sores, bed sores. So many things are there, but nobody is owning them. So that's the reason. And as I already said, 40% of the world is already diabetic. India being the diabetic capital of the world, Hyderabad, this city, is the diabetic capital of India. Just understand what is happening to our lives. Are we all really living or surviving? There is a difference. If your legs are not healthy, what is the whole point? You can't go anywhere in this beautiful world. You can't travel. You will become a burden to your own family. Diabetes is the capital of India. And Hyderabad, the capital of diabetes for India. So we have, all of us should be almost 40%, maybe in the pre-diabetic area. I don't know how many of you are. But when you have foot problems, okay, we all know that diabetic patients will have cardiac issue, right? But before the cardiac issue is actually starting, it is the foot issue which is first happening. We don't know that because foot blood vessels are so thin and all your body weight, 100 kgs or 80 kgs of your body weight is being taken care by your feet. And if the feet is having less blood supply, what is going to happen? The whole tree will collapse. So protecting your feet is the main thing. So why limbs are being lost? Because most of us, even in this room, have negligence. They delay. They think it is a small wound. Nothing is going to happen. Because if you have a small cut in your hand, you will wrap it nicely with a nice dressing. You won't even use the finger because it will pain you. You will even eat with your left hand, but you will not move this finger. We are so sensitive with our fingers. But when you have pain in your feet, when you have wounds in your feet, you still walk on it. You still walk in it where you know that the shoes are wrong. Still you put weight on it. You know the shoes are not clean. Still we will wear them. And I don't know why psychologically because the feet are far away. So maybe that's the reason we don't care about it. But it's the feet which is bearing all your body weight. Now, in the previous slide, yes. So every 30 seconds I said there is an amputation. But in India, 1 lakh amputations are happening every year, which is increasing at an alarming rate of 13.5%. This is the rate of amputations when come to now. I am the podiatric president for Telangana state, and the survey which we have done along with our colleagues, we came to know around 15,000 amputations are happening every year in our Telangana state. 15,000. So we are contributing 15% of the all India amputations. Though we are 40% in diabetics, 15% amputations, 15,000 families are getting affected. Just imagine what will be our socio-economic conditions. And how many doctors are there to save the legs? Hardly 1, 2, 3. This is the reason for me to start advanced wound healing clinics. The birth of advanced wound healing clinics happened because of this reason. This was the gap which I was looking for. There are so many colleagues along with me who are general surgeons, endoscopy, laparoscopic surgeons are there. But nobody is doing for the wounds. That's the reason I got into wounds. I've established advanced wound healing clinics, the Bharat's first advanced wound healing clinics. If you search this name in Google, again you will see only in Pennsylvania, Germany or other parts. But none in India are actually talking wound healing. There may be wound care centers, but nobody can assure a wound healing. That's where it started. Now, for example, this patient, can you please play the video? So this old man is around 87 years. And he went to some of the corporate hospitals, I don't want to name them. Can you just play? And he has been to, I don't know why it is not playing. Okay. So this is story of a 87 years old gentleman. He is 87, wife is expired, kids are NRIs. He alone stays in an old age home. At 87, he developed wounds and he was asked to go for an amputation below knee. From there, he went to another corporate. There they said above knee because even that area is not having good blood supply. Post amputation, the wound may not heal. That was the situation when he came to me and he said, "Sir, if nobody is going to even take me to the washroom after amputation in the old age home, what is the whole point of me to survive? Better you kill me." That was his words. We made the wound heal. I think that was a beautiful video. It's not getting played, but we healed that wound. We made him walk back on his feet. He's very confident and is living his rest of the life. So how many of you are having wounds in your families, foot issues, leg issues? Have anybody undergone any such kind of conditions? Many of you can relate to it. Yeah. We'll discuss. So these are small toes which we think are turning black in color. And we think now it has to go for amputation. Ideally, amputation has to be done only when the bone is affected. If the bone is not affected, the skin can be regenerated. The fat grafting can be done. Muscle tissues, you can have flap procedures, you can have dermal substitutes to regenerate even those areas. But only thing, if the bone is lost, the bone will not come back. Only in that condition, we can think of amputation. Otherwise, just a skin discoloration, you don't need to amputate. So these are those cases. And this man also had a below knee amputation and asked to go for an above knee amputation, but then the video is not being played. But now he is so fond of his wife, he always wants to take his wife, even at the age of 65, on a bike ride. After he lost his leg, he lost all the hopes, but we saved his leg and we gave him nice prosthetics. Now he is driving an automatic car and he's still taking his wife back on ride. So life is all about legs. If your legs are not supporting, you can't do anything in your life. So like I said in the beginning, from birth till your death, it is your legs that are going to travel along with you. You have a heart problem, you can still fix it. But even if you have a leg problem, even if your heart is good, you can't do anything. So mobility is life. So balance is freedom, walking is freedom. That we have to provide for. That is, I think, the best gift you can give to your family members, to your elders. So save legs, save lives, because 50% of the world is already pre-diabetic. Anytime, any one of us can have foot issues. So check your feet first. Protect them, improve the vascularity. Stem cell therapy is the latest technology with which regeneration can happen. New blood vessels can form on your legs, in your feet, and can get back to your life again. So these are some very beautiful cases I wanted to show. I don't know why the video is not being played. So this is Advanced Wound Healing Clinics. This is my logo. Sri Chakram is the biggest yantra which is accepted around the world. And that power, that kind of protection I am giving to the foot of all the people of my patients. So I have kept foot in it so that we can show that your foot is so much protected. And the purpose of healing, the whole process of healing with the principles of RRR, restoration, rejuvenation and regeneration. That is the whole purpose. Whatever loss, refill it.
India's most admired limb salvage surgeon 2026 award goes to Dr. KVNN Santosh Murthy, founder and podiatric and burn surgeon, Advanced Wound Healing Clinics. May I kindly request Dr. KVNN Santosh Murthy to please come forward and receive this prestigious recognition.